Assalamu alaikum. Today we will discuss spinal cord. By the end of the session, you should be able to describe the spinal cord, its location and its function, describes the surface features of the spinal cord and its meningeal coverings, discuss the internal structure of the spinal cord. Firstly, we will discuss the external anatomy of the spinal cord. The spinal cord mainly extends from the foramen magnum to the lower border of the first lumbar vertebrae. It occupies the upper two-thirds of the vertebral column. The rest of the cord is occupied by the chorda equina. Now, just look at this picture. In this picture, you can appreciate the all vertebrae and the vertebral column, and in the center is the spinal cord. The spinal cord, as you can appreciate, it terminates at the lower border of the L1 vertebrae, and the spinal nerves are arising from the different segments of the spinal cord. But after the lower end of the spinal cord, these spinal nerves will curve and they form chorda equina. Chorda equina is just like a horse tail. You can appreciate in the lower part. So these leash of nerves are known as chorda equina, while the lower end of the spinal cord is known as the conus medullaris, as it takes the shape of a cone. That is why this is conus medullaris. As you can also appreciate the meningeal coverings on each side of the spinal cord, which are dura mater, pia mater and arachnoid mater. Now we come the spinal cord different parts. It is mainly divided into the cervical spinal cord, thoracic, lumbar, sacral and coccygeal. Each part of the spinal cord gave rise to different spinal nerves. For example, from the cervical part of the spinal cord, 8 pairs of nerves arises. From the thoracic, 12 pairs, lumbar 5, sacral 5 pairs, coccygeal 1 pair of nerves. So these pairs of nerves arises from the different segments of the spinal cord. The spinal cord is enlarged at the cervical and the lumbosacral parts to give the origin to the brachial and lumbosacral plexuses. It ends into the conus medullaris, as I told you, which is the lower part of the spinal cord. This is the whole spinal cord, and you can see how it is divided into different segments: cervical, thoracic, lumbar and the 5 sacral. And you can also appreciate the sections which are on the right side. And then we will discuss its internal features and the external features. The anterior median fissure is a deep longitudinal fissure in the anterior surface of the spinal cord, while the posterior median sulcus is a shallow sulcus in the posterior surface. It contains the posterior median septum. The posterolateral sulcus is the entry site for the posterior root fibers, while the anterolateral sulcus is the exit site for the anterior root motor fibers. Now just look at this picture. This is the section of a spinal cord. In the center you can appreciate the central canal. Then around the central canal is an butterfly shaped area which is known as the grey matter, while outside is the white matter. Now you can also appreciate the posterior root and the anterior roots of the spinal nerve, and in the anterior aspect you can appreciate the ventral median fissure, which is also known as the anterior median fissure, while on the posterior or the dorsal aspect you can appreciate the dorsal median sulcus, which is also known as the posterior median sulcus. Now if we discuss just the grey matter, then this grey matter is divided into different parts. Anteriorly you can appreciate a horn which is known as the ventral grey column, while posteriorly there is a horn or column which is known as the posterior grey column or the dorsal grey column. In some sections of the spinal cord you will also find some lateral grey column also. Then again, this is this spinal cord, and this is anterior root, posterior root, and these two roots combine to form the spinal nerves. The spinal cord, as I told you, is covered by the three layers: dura mater, arachnoid mater, and the pia mater. What is phylum terminale? Phylum terminale is a prolongation of the pia mater from the apex of the conus medullaris to the posterior surface of the coccyx. This is very important. Then the subarachnoid space. Subarachnoid space at the level of the chordae equina, which was the leash of the vessels, the spinal nerves, enlarges to form the lumbar cistern, site for the lumbar puncture and the spinal anesthesia. The pia mater attaches to the vertebral column laterally by the denticulate ligament. Again, you can appreciate here the subarachnoid space, which extends up to the almost S3 level, and here we can do the lumbar puncture. This was all about the spinal cord. Thank you.